Good evening and welcome to Doctors on Call. How do infectious diseases move through a population? How can we prevent it? And what are the best treatments? I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth, and I'll be your host for our program tonight on infectious disease and immunizations. We'll be happy to answer your questions. Just give us a call locally at 218-788-2844 or toll free at 1-877-307-8762. I'm pleased to welcome our panelists this evening. Dr. Paul Sanford, an internal medicine specialist with St. Luke's Internal Medicine Associates in Duluth. Dr. Stephen Tekippe, a family physician with the Gateway Family Health Clinic in Moose Lake, and Dr. Andrew Thompson, an infectious disease specialist with St. Luke's Infectious Disease Associates in Duluth. Some of our medical students answering phones tonight. When you call, you'll be talking to Jay Allen from the Center, Minnesota, Maren Anderson of Lake Park, Minnesota, or Mindy Kval Anderson, Wilmer, Minnesota. And now on to tonight's program on infectious disease and immunizations. Well, this has been a really hot week for talk of infectious diseases. I was watching the national news last night on TV, and the first 10 minutes were devoted to two infections, and we'll get into talking about those tonight. But these are unusual infections that don't occur very often. Dr. Sanford, I'll start out with a little different type of question. How do we as physicians keep up to date on some of these things? Ebola, Enterovirus, this isn't something we see very often, if ever.
Well, that's right. I've never seen Ebola, and I probably never will. But we always are learning. There are facilities through the Center for Disease Control and through all the major universities and medical schools that are available online and in print. And it's a huge amount of wonderful information that we have access to and that's sent to us also by email. So we're learning all the time.
Dr. Tekippe, how about you? How do you keep up to date with these things?
We have our American Family Physician journals help keep us up to date in a nice rotational type of way. We also watch the news. We know that anything that's in the news is going to be asked in the clinic or in the emergency room or in the hospital. So we try to keep on the edge of that because we're always asked this over and over again. And plus, like Dr. Sanford had mentioned, medicine is exciting by continuing to keep learning, and that's kind of why they call it a practice.
Yeah, there's always something new, that's for sure.
Mm-hmm.
Have any patients asked you about it yet, any of these?
Oh, yes. In fact, it'd be easier to say have any patients not asked me about Enterovirus 68.
Sure.
And that's been the big topic here, not as much the Ebola virus.
Well, let's talk about Ebola. We'll get off to a start here. Dr. Thompson, now, I guess the first question is, what is it, and should we be worried about it?
Well, Ebola, as the name states, is a virus, and it comes from West Africa and some in Central Africa. It's a virus that probably started in animals, perhaps bats, and maybe some other forest animals. And we've known about this for decades. Since the 1950s, there have been sporadic epidemics of Ebola in West Africa. Never have they been so big as this past year when it moved into population centers in West Africa. And as we've all heard, there have been a few cases of American health workers who have been working in West Africa who became infected and then came home to the United States for further treatment. And this week we all learned of a case of a patient who was in West Africa, traveled home, and then became ill. Now, should we be concerned? Yes, I think we should be concerned, but we should temper that with the realization that we live in a different country than West Africa. We have an amazing public health infrastructure, and we have very good healthcare facilities. And I think at the moment, everyone in Texas is working very hard on containing this this patient, the single patient for now.
Thank you. Dr. Sanford, could you tell us a little bit, how does Ebola affect a patient? I mean, what are the symptoms?
Oh boy, it's called a hemorrhagic fever, and people will start out with a temperature up to 103, 104 degrees, terrible sweats, they'll get bloody blisters, bloody diarrhea. Once they start getting fever and start putting out nasty fluids, then they are extremely contagious. They're shedding that virus. And that's where it's so important to have good public health, good hand washing, destruction, burning, incinerating of soiled clothes and sheets. And unfortunately, in some of these huge multi-million people cities in Liberia, Nigeria, there aren't those types of facilities available, and it's kind of scary.
Now it's a virus, and as we know, there really aren't treatments for most viruses. Really isn't any known treatment for this that's effective?
Supportive care, fluids, and there's always some question about whether or not there was some type of an enigmatic mystery serum that was developed. I, honest to goodness, don't know. But it seems like those 2 American health workers that went to CDC were given something that beefed up their immune system. I don't know if you know about what that was, Dr. Thompson?
Yeah, there are some experimental treatments. It's an antibody treatment, so it's sort of an antidote to the virus. At this point, we don't actually know how well it works. We know that theoretically it should work, but there's such a small quantity of this because it's only at present in research stages.
I think they've also used blood transfusions from patients that have been cured from Ebola
Looking for
as
the
well.
antibodies, I suppose.
Correct, yeah.
Dr. Tekippe, tell us about the Enterovirus. I mean, that's the other one that has been much more common this year. Is that something new? I mean, I haven't really heard about this before.
Yeah, the enteroviruses are not new. They've been around a long time. They're also known as the non-polio viruses. There's at least 90, I think, subtypes, and so they're numbered, basically. And we've seen this virus many times before. It gets subtyped and recognized. It's a virus, though, that really has a predilection for children and for patients that have trouble with asthma and respiratory diseases, and also the elderly. It does tend to cause problems that way. We've seen undocumented. We don't type it because that's a test that takes a long time to come back. But we take a history, and I think what the docs were mentioning is one thing that infectious disease doctors have taught us through the years is take the history. And so every patient that comes in the office or in the emergency room or in the hospital, we always add the history as to not only when did it start, what symptoms are you having. We always ask about travel history.
Yeah, I was just going to bring that up. That's come to light just recently.
Yeah,
very
travel
important in this
history
case for Ebola.
Correct. And then who else is at home and have they traveled?
Right.
These are things that I don't remember asking as much before until I did ID rotations and things where there's a meticulous history taking. But enterovirus, we've seen a lot of it. It's fairly nonspecific. It seems to have a couple ways that it'll present. One way that I've seen it present frequently is actually starting with GI illness, with nausea, occasionally throwing up. Then it quickly moves up into the respiratory system, up into the sinuses, the airway, and then it finally finishes up in the lungs with severe wheezing. I've had several children, one that I had to admit, and I did call to talk to some of the pediatric specialists. And interestingly enough, they say that these patients typically respond to steroid treatments like prednisone or methylprednisolone, and that they're withholding antibiotics unless they're truly needed. And with nebulization of albuterol and asthma medicines, as well as prednisone bursts and taper, these patients do quite well with supportive care. And so it's very, we're all communicating and talking to each other, and it makes it a lot easier.
Thank you. Well, let's get back to some, these are two very interesting illnesses, and the enterovirus is common, the Ebola not very common, but there's a lot of things that are a lot more common. Here's a question from a caller in Duluth to Dr. Thompson. Are pneumonia shots lifelong, or are boosters required?
That's a great question. And we have some new information on it this year. So the pneumonia vaccine protects against a number of different types of Streptococcus pneumoniae. So that's one type of bacteria that has various different strains. And typically we recommend that patients get more than one vaccination. There's a new type of vaccine just approved recently for older folks to get at the age of 65, and then within a year or so to get another booster vaccine, just to help give them extra protection and immunity.
Okay. What if they've received the vaccine already, the older vaccine?
Then we also recommend that they get the new PCV13, it's called, vaccine, after a period of time has elapsed.
Okay.
But it's best to check with your doctor so you can sort out the schedule, because it gets very complicated.
Okay. Well, thank you. A question to Dr. Sanford, caller, wondering, what is scabies?
Oh.
It's an infection.
Kind of makes you itch. Yeah. No, scabies is a lovely little bug that gets in under the skin, and sometimes like lice, and it can spread through schools or communities or close households very quickly. And you have to watch for little nits in the hair, look for little thickenings that you can't see if they're bugs, but anything where you get an itchy and scaly rash, just get your Quell solution or whatever type of anti-scabies your doc gives you, and then just wash everything in the house. All your sheets, all your clothes, everything. And check your kids when they come home from school every once in a while. It's going to be here forever and ever. It's one of those lovely little parasites that just live with us.
All right. Thank you. Dr. Tekippe, speaking of which, of infections and immunizations, how many strains of the flu are there with this year's vaccination? Is this year's vaccination, is it effective?
Yeah, that's a great question. There's basically two types of immunizations that we're using, at least in the clinics. And one of them is an intranasal, which is a live virus. And it's attenuated virus, which means that it's weakened significantly, and you won't get the flu from it like people worry about. But you have to be careful which you give that to. You don't want to give that to anyone under 2. It's indicated for age 2 to 49. That has a combination of 4 different strains of influenza in it. It actually provides better immunity, they think, than the inactivated vaccine.
And the shot?
Yeah, there is two types of the inactivated, the shot. One contains 3 strains and one contains 4. And we don't really know how effective they are until the season's over.
Sure.
But they do take about 9 months to produce, and so it takes time to develop these, so they have to go on their best estimate from the year before, typically. And they're constantly watching this. That's one advantage of the internet and the coordination. They're watching these throughout. There's even a website you can go on and you can find which of the flu viruses are developing and coming, and the CDC is constantly watching that and trying to arrange the immunizations.
Thank you. Dr. Thompson, speaking of influenza, is H1N1 going to be coming back?
Probably, but no one knows ahead of time for sure. We have seen H1N1 in circulation now for multiple years. And influenza is always changing. That's why we need a new vaccine every year, because it mutates a little bit and it recombines, and it's always a moving target, basically. So the people who make vaccines do a very good job of predicting, based on what infections they're seeing in the Southern Hemisphere and in Southeast Asia the year before. Lately, they've had a very good track record of matching the vaccine to what illnesses we're going to see. So year by year, they do a very good job.
Thank you. Now, as I understand, they still make the vaccines in eggs. Is that right?
That's correct.
And you think in this day and age they'd have something a little more sophisticated?
Well, it would be nice to see them made in cell culture, which is the slightly more sophisticated way of doing it, but the technicalities of it are a little beyond me. That's for the manufacturers to sort out.
I'm sure. Dr. Sanford, you know, this caller from Wisconsin just read my mind because I was going to ask, what is MRSA?
Oh, cool. Yeah, methicillin-resistant Staphylococcus aureus. There'll be a quiz later. It's a nice little round bacteria that happens to be resistant to a lot of the antibiotics that we normally use to treat infection. And it can be found on any type of surface. A lot of people carry it and are not infected. But when it gets into a hospital setting and you have people with open wounds from after grandma had her knee replacement, you don't want to get methicillin-resistant staph. You don't want to get any staph into those wounds. So we tend to be very aggressive with gloves, hand washing, robes. We just don't want to share it. But it's not some nasty thing that's going to kill everybody on the planet.
Thank you. Dr. Tekippe, is it a caller from Duluth wants to know, is Lyme's disease infectious?
Lyme disease is infectious. We have the highest incidence of Lyme disease in the world in our county in Minnesota. And so, yes, it's by definition very infectious.
That's Moose Lake. You live in Carleton County or Pine
Carleton County and Pine.
Okay.
I live
we're
in
in St. Louis now, so we're good, right?
Yeah, then there's no, yeah, right. No, so Lyme disease is, yes, it's very much infectious. The good thing about Lyme disease that people need to know, though, is that most of the time it gives you good warning signs. Most of the time you'll see a rash about 90% of the time or more if you really look for it carefully. It can be very subtle. Everyone comes into the clinic with a rash from the tick bite, okay, about the size of a quarter. The Lyme ECM rash, they call it just for short, is much bigger typically. It can be multiple. It often has central clearing target type. But Lyme is definitely infectious. It has different stages the longer that it goes on. If there's questions about it, be sure to talk to your doctor about it. Sure. Once Lyme is treated, it's typically treated. You don't have to keep retreating it.
But you can't catch it from another person?
No,
okay.
Not typically. I never say never, but no, not at this point. It's typically transmitted by by deer ticks.
Well, thank you. I have another question here for Dr. Thompson, and this is a good question. I've kind of wondered about this. Caller from Duluth, does it hurt my child to space out his vaccinations? The recommended timeline seems like so much at a time. It is pretty intensive.
That's a good question. It doesn't necessarily hurt your child to get them spaced out. The important thing is that a child get their vaccination by particular landmark ages. However, there hasn't really been shown any harm in getting those vaccines all at once. So if you get 3 shots on the same day, you can take Tylenol that day and get it all over with rather than having a shot this month and next month and the following month. And there's no decrease in efficacy of the vaccine by giving all 3 at once. That's a question that I get sometimes too.
Continues to work.
They work well, even if you get multiple vaccinations on the same day.
Okay, thank you. We've got a lot of questions on vaccines, which is good. I'm glad people are asking. Caller from Duluth, Dr. Sanford, how effective is the chickenpox vaccine?
Oh, that's great. Yeah, the varicella zoster vaccine, very controversial. We were talking about it before the cameras even came on. It's not a super effective vaccine. It may reduce the intensity and prevalence of shingles when given to adults, but people still who have had a shingles shot still come in with shingles. As far as the chickenpox vaccine in children, I'm not sure of the data showing how much it protects these kids as later they become adults and if they have lower incidences of shingles. I think if they never get...
It's been around for long enough to even
Yeah,
know.
I don't think it has been.
No, you're right. In America, it hasn't. In Japan, it's been around 20 years before it came to America.
Oh, interesting.
And so they did show those things you were mentioning.
So there's a lower rate of shingles in people who have
Yeah, and they're not as intense, I guess. Not as intense, and there's a lower incidence of them. There's nothing worse, they say, than the wild type varicella, the wild type chickenpox. You know, you always hear people say, well, I'm worried that if I give my child a vaccination and then he gets chickenpox later, we all know that if people get wild type chickenpox when they're adults, they often have much worse symptoms. But that's nothing, they've already looked at that, and you guys can correct me, but I think what they've found is that in general, there's really no reason not to get the chickenpox vaccine for children. There isn't great efficacy or effectiveness to speak of, but I mean, it makes a difference overall for everyone.
Thank you. Here's a topic here is for Dr. Thompson. Is bronchitis contagious?
There are different kinds of bronchitis, and the most common one is probably a viral bronchitis. And in that sense, yes, viruses are contagious. And so most bronchitis is probably contagious, just like a cold is. But there are other forms as well that are non-infectious, because bronchitis just means inflammation of the tubes in the lungs. And so there are a few other causes as well.
How about antibiotics? Should we give antibiotics for bronchitis?
Well, like I said, most bronchitis is viral, and antibiotics are of no use against a virus. So no.
Thank you. Dr. Sanford, a question about, are vaccines related to autism?
No. There is absolutely no credible evidence that vaccinations are in any way associated with autism. There are a lot of very well-meaning people who have been very misdirected by some, I'm trying to think of nice socially correct terms here. Anyway, the vaccinations are not associated with autism, period. I defy anybody to show any true study making a linkage. It is so critical that we vaccinate our kids. We're seeing kids now with measles encephalitis in numbers that we haven't seen for 50 years. Adults, whooping cough, diphtheria. That's an obscenity in a country like ours. Everybody should be vaccinated. There's no excuse not to.
Thank you. Dr. Tekippe, here, there's another question here. How do you find out if you have MRSA?
MRSA, as Dr. Sanford mentioned, means methicillin-resistant Staph aureus. The way you find out is it has to be cultured. Typically, we do nasal swabs on all, at least we have been monitoring all hospitalized patients for the presence of MRSA. So typically, it has to be cultured, but I want to go back to the history. Taking the history or asking the patient where they've been. Have they been in the hospital recently? Do they have other people in the household that have had MRSA? Those types of questions are important. They often will present, at least where I see them a lot, is in the clinic. People will come in and they'll have what they consider a boil or an abscess. And that's your first tip-off that it could be MRSA. So precautions are necessary. We wear gloves, of course, and we are very careful with that so that it doesn't get spread.
Thank you. Here's some interesting questions, a couple that are related. One caller from Duluth wants to know, about 10 years ago, maybe it probably was longer than that, I got a shot for Lyme disease to prevent Lyme disease, but they don't give it anymore. Whatever happened to the Lyme disease vaccine? That sounded like that would be unnatural around here.
Yeah. No, that's a great question. And there was a vaccine for Lyme disease on the market for a short time. And there still is for animals. You can get a
why are
Lyme
animals?
vaccine for your dog,
Not
but you
fair.
can't get one for yourself. The business of vaccines is a little bit complicated, and the manufacturer basically has to be able to have enough potential patients to give the vaccine to in order to make it. And I think they've done the cost analysis there and figured that it may not be worth it for them to produce a vaccine.
Were there side effects from the vaccine?
There were a few side effects, but I think there was more hype about the side effects than there actually were.
Oh, interesting.
So it's there was some anti-vaccination sentiment that accompanied that. I don't know if we'll have another Lyme vaccine. Maybe if the incidence increases, it might become more relevant.
Interesting. Well, thank you. Well, I think we're out of time. I want to thank our panelists, Dr. Paul Sanford, Dr. Stephen Tekippe, and Dr. Andrew Thompson. And our medical students, Jay Allen, Maren Anderson, and Mindy Kval Anderson, please join Dr. Ruth Wester next week for a program on women's health when her panelists will be Dr. Jennifer Boyle, Dr. Brianne Brandt Griffin, and Dr. Addie Lakari. Thank you for watching, and good night.